Joining me today is Dr. Greg Nestor. Now, Greg is a liposuction specialist. Now, I know it's a terrible statement to say that you're a liposuction specialist because there's a new type of liposuction out there, and this is kind of what you've been into. So kind of explain a little bit what this new liposuction is.
It's called vasal liposculpting. Compared to traditional liposuction, I'm sure you remember that when you're going through training, just that you take a probe and just basically cheese grate out the fat. There's no specificity to it. Nerves, arteries, veins, it's all being damaged, and you'd have the bleeding, the infections, long recovery times, very painful. Well, with Vaser, we use an ultrasound that's very gentle, specifically targets the fatty tissue, breaks it apart, still preserving other tissues that are around it, the arteries, the veins, the collagen.
Mm-hmm. Now, you obviously inject something in there to make those things obviously not hurt. Is this something that people have to go to sleep for, or is it something that basically they can be awake and help you with?
You're totally wide awake. There's no IV. It's done under local anesthetic in the office. Basically, what I do is numb up the skin with a very small needle. Then I go in with a small cannula, a small probe, and I put what's called tumescent anesthesia. It's a combination of normal saline, lidocaine, epinephrine, and I fill that space between the skin and the muscle where the fat's at. Yeah. And once we have that fat layer filled with this fluid, everything's numbed up. Then I come in with this ultrasound and I liquefy, emulsify the fat into a buttery consistency. Mm-hmm. Once that is emulsified, I can take another cannula, come in there and suction that fluid out completely. The skin comes down, and the heat of the Vaser gives a skin retraction. It actually makes the skin tighten up over the next 1 to 2 months.
Now, I know that a lot of people out there saying, well, liposuction is liposuction, this may be a new twist to it. But this is not all that you do. You do other things as well. This is kind of a piece of your package, not the only thing that you're looking for weight loss and other things.
Right. We started this after we have a weight loss center, and people would lose weight, and it was a way for us to, someone who's lost, say, 60 pounds, and they're doing great on their diet, they keep it off for a year. We're able to take this offer to them and get them over that hump. You know, you may have that little pooch in your belly or the love handles that men have trouble getting rid of. This is a way to get rid of that. So it's very motivating, as long as you're doing the right lifestyle, eating properly, exercising.
Yeah, now, an average person, if I walked in and I didn't do anything before, I say, hey, can you just take this fat off me? What would be your answer?
If they're not doing the right things, you know, that's not somebody we want to do, because the fat's going to come back, you're not going to keep it off. We're there to help somebody have a long-term goal of healthy lifestyle.
Yeah, now this healthy lifestyle that we're talking about, what are some of the health benefits of doing this? Besides looking better, because we always want to look better, isn't there other stuff that helps us here?
Well, my experience has been anytime you lower a person's fat, percent body fat, you're going to have improved control of the blood pressure, improved control of diabetes. I've seen cholesterol profiles improve, the lipids, the triglycerides. I had a patient with sleep apnea. The symptoms of sleep apnea improved. When you lose weight, your joints feel better. And again, going back to things like being able to get rid of those areas that you're working out and they're just very frustrating when you can't get rid of them. Mm-hmm. And it's motivating. If you come out and all of a sudden you've been working out every day and you can't see a change, all of a sudden you see this change, it's motivating. It gets you over that hump.
Mm-hmm. And so there's health benefits, there's a lot of things that will help. Now, you also do a little bit more specific liposuction as well. This Vaser does a thing that other people can't get done.
Right. I've been doing Vaser for a couple of years, and I did some advanced training in Vaser liposculpting, and it's called ultra high definition Vaser liposculpting. Mm-hmm. It's much more sophisticated and technical, and we use anatomic, artistic principles to bring out a person's own muscular. Six-pack abs, the hourglass figure in a female. It's beautiful. The results you get, this is patient's own muscle. You're just removing the fat on top of it to give this gold ring of health, the six-pack ab.
Mm-hmm. Now, doesn't happen. I go in one day and I walk out with six-pack abs. What was the expectation? It's kind of a healing time, correct?
Right. It takes about 1 or 2 months to completely heal, but by the time you leave, you're going to see a big difference. Then there's some swelling, and it just, after a week, it just gets better every day.
And about what's the time frame where we'd say that we're 100% good? You said that you have people that go out and play golf right after the procedure.
Right. The advantage is very fast recovery. People, as I said, there's no anesthesia. You get up off the table. I actually just do some of this with them standing up. And they get off the table, they leave. I say, get back to your regular activities. You can start exercising tomorrow. If you want to play golf this afternoon, go ahead. You're going to be a little sore, but there's no limitation. You can't hurt yourself.
And safety profile is a pretty safe thing. We're not worried about infections and other things.
Exactly. Minimal bruising, minimal swelling, very minimal pain. and it's extremely safe.
Yeah. Now, obviously, it sounds like a great thing. Sounds like it might be a little expensive. What would you say is the average cost, and how do you work that out for them?
The average cost is probably between $1,500 and $3,000 per body part. Everybody's different, so we have to look at somebody, see what they need to have done. It's much cheaper than traditional plastic surgery procedures. Mm-hmm. Obviously, it's in the office. It doesn't have all the surgery equipment that you need in a hospital, the staff.
Yeah, but the safety profile's there, so we're not worried about that. Cost is a little less, outcomes are a little better, and we're able to do things a little faster. So it sounds like a really nice thing. Now, health benefits from my point of view, since I'm a physician, is obviously less diabetes issues, blood pressure is probably better, self-esteem, depression issues kind of help as well.
Absolutely.
So it sounds like a really nice package. Well, thank you very much for joining us today. It was really informative, and hopefully as our people out there are watching, maybe they'll give you a call.
Great, thank you.
Mm-hmm.